Assalamualaikum and good evening. I'm Dr. Ruhima from University of Cyberjaya. I'm a family medicine specialist. I work in family medicine department, University of Cyberjaya. I was given this topic about 2 weeks ago. I was approached by Datuk Rahim and Dr. Noaini. They said they have a special gift for me after Valentine's over the weekend. And I said to them, I don't work on Saturday. And then they say, this topic might interest you, given the experience that my sister suffered from thyroid cancer, and my auntie died of breast cancer, and that my brother-in-law was diagnosed with chronic myeloid leukemia. So this might interest me. So imagine the world when your loved one was given a diagnosis of cancer diagnosis, the fear that they have, right? For giving the diagnosis of cancer diagnosis to your loved one especially. Today, I would like to invite you to join me on this awe-inspiring journey through the power of screening, early detection, and prevention in the fight against cancer. All right, this is by our Malaysian government. Together we can transform the fear into empowerment and uncertainty into hope. Let's journey together towards a future where prevention succeeds and early detection becomes our greatest ally in the battle against cancer. So can I have my next slide? So my topic is prevention, screening, and early detection of cancer in Malaysia. So for your information, I'm not an expert on cancer screening, but I will try my best to answer all the questions. All right? So next. So this is the outline of my talk today. The statistic in Malaysia based on the National Cancer Strategic Common Types of Cancer in Malaysia, understanding prevention and risk factor, the importance of regular screening, available screening in programs in Malaysia, early detection and its impact on treatment, signs and symptoms to look for, lifestyle changes for cancer prevention, additional resources that is available. I saw a few booths outside, and question and answer at the end. Next. I'll try to go very fast. This is my reference, the National Strategic Plan for Cancer Control Program. To answer your question, sir, in health clinics, most of the health clinics, they are given for free if you come for HPV screening. They will give the sample, the sticks to all the patients. Whether you are B40 or not, they will give it. They will do it for free for you. Okay, cancer is one of the most important NCDs globally, and incidence is expected to continue to increase, and the expected increase in incidence may lead to the rapidly aging population. I'm 60 years old, all right? So this is the aging population and their behavioral risk factors, all right? According to WHO Global Report 2020, they said the global burden of cancer was 19.3 million new cases among the 8 trillion population of Earth, and 9.9 million cancer deaths, and 50 million people living with cancer within 5 years of diagnosis. Malaysia is like most developed and advanced developing countries, is also approaching an epidemiologic transition because diseases related to the lifestyle, especially the cardiovascular and cancer, has become more prevalent. Okay, the cancer contributed about 12.18% of all deaths in the Ministry of Malaysia compared to 9.54 in 2004. This is the statistic that I get from National Strategic Plan for Cancer Control Program 2021 to 2025. Next. This is the top 5 principal causes of death in Malaysia. In 2004, cancer contributed about 9.4%, but it has increased in 2019. It has increased to 12.18%. Next. According to the Malaysian National Cancer Registry, common types of cancer is breast, I'm sure, right? Breast, colorectal, lung, and nasopharyngeal cancer. All right? It has increased from 2007 to 2011 by 11%. The ESR also increased to 2.3 per 100,000 population female, and then it reduced by 0.8 per 100,000 population in males. This is just a statistic, okay? Next. So this is the top most common cancer reported in year 2012 to 2016. CA, breast, colorectal, lung, lymphoma, nasopharyngeal, leukemia, prostate, liver. You see, it's number 9, the cervical cancer there. And ovarian is number 10. All right, go to the next. Even in health clinics, most of the health clinics, at one time, they offer for women above 50 years old to be referred to the hospital for mammogram for free. For free. All right? So according to WHO, 30 to 50% of cancers can be prevented by avoiding risk factors. For example, because these are the 5 leading behaviors and dietary risks. The high BMI, low fruit and veggie intake, lack of physical activity, tobacco use and alcohol use, in which tobacco use is the most important risk factor for cancer and is responsible for about 22%, right, of the cancer death. Next. I will try to go faster. Understanding the risk factor. So based on the survey that they did, they said a study in 2014 served as a baseline where general knowledge on cancer risk factor was about 62%. It's not even 100%. And the general knowledge on signs and symptoms was about 52%. So are we doing enough to educate our population on the sign and symptom of cancers, right? So maybe we can give some ideas on how to improve on the education, public education. But there is no information on the public acceptance and behaviors toward cancer screening and proven or unproven therapy. But this one can be done in health clinics. Anyone from health clinics here? Any doctors from health clinics? Okay, no, all right. So these are the research that you can start with or survey on the acceptance of behavior towards cancer screening so that we can know how to improve our program. So next. So importance of regular screening, WHO has 3 steps of implementation, but in health clinics, because I'm working in health clinics, so we have, the step 1 is quite simple because we have the HPV there, we have the population there, so all we have to do is just, really? Go to the next one. All right, so available screening programs in Malaysia is cervical, as you know, the ROSE program, which is quite important. Breast cancer, the triple, the clinical self-breast examination or CBE, or clinical breast examination, and colon cancer screening. Go to the next. So breast cancer, this is the triple, for screening in Malaysia, women aged 20 years old and above must undergo breast examination by trained HCPs every 3 years between the age of 20 to 39. As I mentioned just now, in health clinic, above 50, they will refer you to for mammogram for free. Next. Colorectal is the IFOBT. Next. A cervical cancer, we are using the HPV self-test. It's no more the pap smear anymore. They will give you the test, and then the patient will bring it back, and then come back with the sample for us. Okay, the screening interval, as she mentioned, is every 5 years. Next. Oral cancer, this is done by the dentist. Next. Lung cancer, they said there's no, based on the evidence, the LDCT is not sensitive enough, right? I mean, to detect lung cancer. Next. Next. Okay, NPC, I think, also they said the EBV serology is one of the good way to screen, but they say because there is no evidence on the cost effectiveness. Next. Prostate cancer, the PCA, they recommended only for the high risk group, mainly close family members only. Next. So I think this is just to, the early detection and impact on treatment is very important for early detection. Next. So these are the signs and symptoms to look for. This is mainly for the primary care doctor, all right, to screen, to look for signs and symptoms, and then when to refer. Next. Early detection, this is the thing that we do in health clinic. Next. Okay, so early detection, this is what I get from CPG. I think you can look at this. Next. Okay, for cervical cancer, I think based on the HPV and also pap smear, and when to refer. Next. Okay, triple assessment of breast. So if you have all the triple assessment, the confident diagnosis is about 99.9%. All right, if you have that. Next. So lifestyle changes, I'm sure that sucrose, it applies to everywhere, right? Physical activity and the diet. Okay. Next. So barriers, lack of knowledge in symptoms, as I mentioned just now, psychological burden as a factor in delay of treatment because of the social cultural effect. They believe in the BOMO and traditional rather than the medical doctors. Health system issue delay in referrals and appointment to diagnostic facilities. Next. Okay, cancer survival, because it has some impact on the economy if it is at the late stage. Next. So this is the resources. Next. So this is just, I just want you to see the video, ACOS, they develop a video in which maybe the government or any NGO can develop a video that you can post in YouTube in which the population can understand. It's a very simple video. I think I don't have the time anymore. Okay. I'm sorry. So go to the next. You want to see this?
Yeah.
It's about 2 minutes.
Yeah, okay.
This is very interesting because I think all the NGOs should come out. I mean, something that you can educate the population about early screening, early detection, when to come to go to the hospital. So for you, sir, there are a few cancer screening available in health clinics, which is given freely to all Malaysian citizens. That means IFOBT, the mammogram, HPV, those are the screening for free, for cancer screening in health clinics.
Yeah, it's very sad. By the time they do the breast screening, the fourth stage, my friend's wife, now in fourth stage, have gone through the 6 cycles of chemotherapy but still surviving. So that's why I'm very concerned about this also. I have also other friends, one died of ovary cancer. So I'm very concerned about this cancer thing. But in future, if this add in the slide, sometimes we don't have enough sleep. My niece got breast cancer, and then my brother-in-law told me she don't have enough sleep, not enough rest. So there's a risk of getting cancer. So please add into your slide. Rest or sleep is very important. And then always hear of the health talks program, but they never include one thing: drink enough water.
Drink enough water. So I think that's why in health clinic or KK clinic kesihatan, right? So we have the screening. One of the screening method is clinical breast examination, which is done by a trained professional. So anyone above that age, when they come in, the nurses will do the clinical breast examination. If they think it's suspicious, they will refer to the doctors. And then we will decide whether we should refer for mammogram or further referrals to the hospital. Right?
Thank you.